We will go ahead and call our Benefits and Insurance Committee meeting into order. Before we get into the call to order, or the roll call, I must make this opening statement, an electronic meeting determination. This meeting of the Benefits and Insurance Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus. Is there a motion?
Motion to approve, Chairman. This is Mary Hickerson.
I have a motion from Mary Hickerson. Is there a second?
Second, Jeff Phillips.
Second, Jeff Phillips. Ms. Thompson, if you would please call the roll.
Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Alan Farley.
Yes.
Mary Hickerson.
Yes.
Lois Miller. Lois Miller.
Yeah.
I saw her lips move. Looked like yes.
Alan McAdoo. Jeff Phillips.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
Looks like we have a quorum. Thank you very much for joining in today and attending, and other guests that are zooming in today. We'll start out with our approval of the minutes as mailed from our August meeting. Is there a motion to accept the minutes as mailed?
Move to approve as Alan Farley.
Alan Farley on the motion to approve the minutes. Is there a second?
I'll second. This is Mary.
Mary Hickerson on the second. Any additions or deletions? Seeing none, Ms. Thompson, please call the roll.
Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Alan Farley.
Yes.
Mary Hickerson.
Yes.
Lois Miller.
She said yes.
Alan McAdoo. Jeff Phillips. Shantae Sherrill.
Yes.
Eric Tutobeni.
Motion passes.
Can you hear me? Yeah, yes.
Okay. Thank you, members. We'll move on to item number 12 on the agenda, the financials. Mr. Elam, you're recognized.
Yes, sir. Chairman Ketron, at this moment, we're doing a little training with our office, and so Melissa Griffey is going to do the financials today.
Ms. Griffey, you're recognized.
Thank you, Mayor Ketchum. Good afternoon, committee. I'll start with the 264 fund report. If you look at August 20th, the revenue stands at $1,848,662. The expenditures for the month of August 2020 is $8,165,207, leaving a negative balance of $6,316,545. If you'll move down to the total enrollment count for the month of August 2020, we are currently at 6,257 enrollments. If you move back to the year-to-date, the calendar year-to-date totals, with 4 months remaining in 2020, we are at 51,884,319 in revenue. We are at 54,960,862 in expenditures, leaving a negative balance of $3,076,543. We will drop down to the fiscal year to date with revenue sitting right now at $3,577,366. Expenditures are at $14,777,630, leaving a negative balance of $11,200,263. If you remember, in the months of July and August, the revenue is down due to the Board of Education's premium deductions are calculated the same annual amount as the county general population on a 10-month basis instead of a 12-month basis. If we move on to the Fund 266 report for the month of August 2020, claims reported are $33,145.15, bringing a year-to-date claims total to $104,133.76 for 2020. If you will look down comparatively to the same August 2019 claims, we were at $48,040.93, and year-to-date was $48,040.93 in 2019. I'll also remind you that for the months of July 2019, due to a conversion between the TPA for our on-the-job injury program from CCMSI to Collins & Company, there were no claims paid in the month of July, so we were able to catch that up in the months of August and September of 2019. That concludes the financial report, Mayor Ketchum.
Thank you, Ms. Griffey, for that report. Questions? Questions from the members? No questions? Any additions or deletions? Is there a motion?
This is Lois. Move to approve.
Have a motion from Lois Miller. Is there a second?
Second from Mary.
Second from Mary. Ms. Thompson, if you would please call the roll.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Alan Farley.
Yes.
Mary Hickerson.
Yes.
Lois Miller.
Yes.
Alan McAdoo. Jeff Phillips.
Yes.
Shantae Sherrill.
Yes.
It's all yes, sir.
Benny.
Eric Tutubeni.
Yes.
Eric Tutobeni.
Yes.
Thank you. Ms. Griffey, I conclude your report. Is that correct? Okay. Next, we have members. We have the workers' comp, OJI, statistics. Mr. Good. Yes, sir. Good afternoon.
I'd like to report in the month of August that the county had a total of 22 injuries requiring medical attention. As you look at your report, you can see the breakdown there. That brings the total for the year-to-date to 104. Of those, 74 are OSHA recordable. there were 45 restricted days, 13 lost time days, and 16 all others. As you look at the next page of your report, the graph will show you that we had 104 total for the year-to-date as compared to last year at 172 and the previous year 169. Again, just to remind everybody, the schools actually had closed down on March 15th, so the schools have been out until the 1st of August for about 4.5 months at this time. As far as the incurred dollars, on the next page of your report, you'll see a total for the year-to-date is 482 compared to last year at 343 and 342. This year, for the month of August, the incurred dollars were a total of 142,000. We had one or two claims that were evaluated a little bit higher than normal, and that's why the sharp spike that you see there right now at the moment. As you look at the breakdown for the different divisions within the county, you'll notice that the Board of Education had a total of 11 of those injuries, and the county government had the other 11. The county government, we broke those down with the Sheriff Department having 6, Juvenile Detention Center had 1, Correctional Work Center had 2, and then EMS had 2, and that brings up the total to 11. I brought to you today the injury illness statistics recap. This is a recap that we do once a year. We take the information from the OSHA 300A log, the one that we do at the very end of the year, and it's reported to OSHA in the end of January of each year. And this brings the information that you see on the first page of your report where we talk about the lost time days and the restricted days. We add to that, we also put into it the mix, the number of employees that the county has and the man hours worked in the county. So if you look at your report there and you'll see the first 2 big blocks that you see, that's off of the OSHA 300A log. You can look and see where we were in 2007 and look and see where we are in 2019 as far as employees and man hours worked for the county government. And this includes all the Board of Education, the highway, and all the county employees. We take that information and we apply the equations that you see at the bottom of the page, and that's where we come up with the last block on to the far right there. And the one that I like, 2 things I'd like to point to you is the one in black that says total incident rate. In black, that is the county's numbers. And the one right next to that, state incident average, that is the state number. And the state number is taken from all local governments reporting to the Workforce and Development Division for the state of Tennessee. And they put those numbers out so that we can actually see where we rate county government, local government, compared to all the other county and local governments within the state. They do not have the numbers published yet for 2019. The state doesn't. But our number for 2019 is 3.05. Last time reported for the state is 4.4, and we compared to that in 2008 at 3.09. So this is just a tool to use to take, if you would, and the numbers that I report each month to you on the first page of the report to kind of give you an idea of where we stand now over the last several years with the manpower increasing for the county and the work hours, and get that comparison. And that's all I have this time, sir.
Thank you, Mr. Good, for your report. Questions from Mr. Good on his report? Any questions?
Move to approve the report, Mr. Chairman.
Have a motion from Commissioner Phillips. Is there a second?
Second from Holly.
I didn't catch your...
Who was the second,
Who was the
please?
second?
Holly.
Holly.
Holly Gearing.
Holly Deering. It's on the second. Any additions or deletions? Hearing none. Call the roll, Ms. Thompson.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering,
Yes.
Alan Farley,
Yes.
Mary Hickerson,
Yes.
Lois Miller,
Yes.
Alan McAdoo, Jeff Phillips,
Yes.
Shantae Sherrill,
Yes.
Eric Tutobeni,
Yes.
Motion passes. Thank you, Mr. Good.
Thank you very much.
Yes, sir. Next, we have our wellness update from Chuck Chappa. Chuck?
Thank you. Can you hear me okay?
Yes, sir.
Alrighty. Currently, as of 10/1 for the month of September, Motivate Me annual physical count is at 1,708 as opposed to 1,597 from last year. Biometric screenings were sitting at 2,003 versus 3,018. Health assessments are 461 versus 1,914. Mammograms, 947 versus 917. We've actually increased how many mammogram events we have for this year as well. OBGYN screenings, 1,521 versus 1,533. Colon cancer screenings, 339 versus 323. Cervical cancer screens at 1,317 versus 1,344. Prostate exam screenings, 400 versus 365. Flu shots, 1,891 currently versus 1,700 from last year. And if we were currently activating this system, we would be at 2,844 individuals that had met their 3-point requirement versus where we were sitting last year at about 3,531. So some of these are preventative screenings and things that people are going out and getting, and then others you can see noticeably a difference in engagement in regards to that. Moving on, we're currently working diligently with the new St. Thomas crew to get a lot more mobile mammography opportunities out, as well as we're currently working on a flu shot event solution as we speak. But that'll wrap up everything I have for this month.
Okay, any questions? It is, you mentioned flu shots. It is flu shot season, so we encourage everyone, everybody you talk to, members of the committee, your colleagues at work, please urge them to go get their shot and get their update this year. We need to try to keep everybody healthy. Mr. Elam?
Mayor Ketron, if you get your shot August 1 or later, it'll go on your points for the 2022 incentive. I'm sorry, October 1st.
October 1.
Yeah, October 1st, it goes on your points.
Okay, remember that. October 1st, go get your shot. Anytime after that, you get the shot, and it goes towards your total points. Right, Chuck?
Correct.
Okay, thank you.
Thank you.
Yes, sir. MedPoint report. Christy Martin. I just want to say before she starts talking that we went out, was it last week? I guess we had a ribbon cutting out there last week at the new location for us, our walk-in clinic at Ascension St. Thomas, crossing the Publix out there on Highway 99. And just very, very impressed with the new facility for our employees. They're going to have a great opportunity to go into almost a brand new facility for their wellness needs and be taken care of. It's a big step for us from where we came from, so I was very much impressed. And St. Thomas just been all over it. They're anxious to start helping. Christy, are you on?
I am, Mayor. Thank you, and good afternoon, everyone. I am going to attempt to share my screen here. Let's see. I apologize. This is my first time sharing. Well, I may just have to. There we go. Okay. Can you?
I was going to tell you to ask Alexa to help you.
Yeah, right. That's what I need, some help from Alexa. Can you all see my screen?
Yes, we got it. Go ahead.
All right. So this is a brief update, and thank you, Mayor Ketchum, for mentioning the ribbon cutting. That was an exciting day for for all of us. We're very excited to be in this partnership with Rutherford County and look forward to just increasing engagement. I would say that's our top priority right now. The clinics are up and running successfully. As with anything in a transition, there's a few bumps here and there, but nothing major. So we've been very pleased with that transition. Lots of planning, both from Ed's team, including Jane and her help, and our St. Thomas team, and we made it happen successfully. So today we've got on the phone with us. I wanted to introduce Dr. Keisha Gift. She's our MedPoint Health Center Medical Director. I've also invited Beth Wilson. She's our Manager of Business Operations for our Murfreesboro area. And then also Amber O'Neill. Amber is the MedPoint Health Center Manager. They really complete the team that's there to support these clinics. And so very happy to have them on board. Invited them today just to listen in and get a glimpse of what this committee does for our community and how this intertwines with our MedPoint clinics. So they're all very accessible to all of you, as well as myself. Jane is our point of contact from the county, so you're always welcome to go through her to find one of us, or we're also happy for this group to reach out directly. As I mentioned, we are in the transition phase, I think kind of coming out of that, almost completing our first month. But wanted to give you a glimpse at the numbers, and this is very basic. Next month we will come with a detailed report outlining some quality as well, likely. But wanted to just show you our New Salem clinic has been our most successful thus far. Remember that clinic is also open on Saturdays, or the only clinic open on Saturdays. And then that clinic also offers walk-ins, which have been successful for us thus far. Stewart's Creek seems to be our lowest volume clinic. We're working with the schools there on campus just to make sure the teachers know that we're there and available, but just encourage you to spread the word as well. And then Walter Hill, hanging in there. They tend to have a pretty packed schedule. So we were able to keep Carla Adams at that site, if any of you know her. So she's got a great established panel of patients that are very engaged. So that's really all I have for today, and would just pass it back to Ed if you have anything else, Ed, that we should speak to today.
Anybody have any questions for Ms. Martin?
Mr. Chairman, I have a question. I'm not sure if Ms. Martin can answer it, or maybe Mr. Elam can. This is Mary.
Go ahead.
All right. Looking at the numbers on the clinics, do we know how that compares to what we were seeing under the direction of the other TPA for these clinics? Are these about the same numbers? I do realize that we pulled the walk-ins out of Stewart's Creek, but how do these numbers look at what we were seeing prior to this, or were they even captured that way?
Mr. Elam?
If I could address that. Mary, I didn't even really look at the numbers to compare the two, because usually the month of September is everybody's trying to get their last points or two for the Motivate Me incentive program. So this year not having it, and if you look at the Motivate Me report, you can see that there are some things, several columns that are down compared to last year. So I think a better comparison would be the month of October and maybe November, to take a look at it then. But I do know, just off the top of my head, it is down from last year.
Okay, thank you. That makes sense. So if we could kind of put a little note on there for October, or maybe wait and see what October and November does, see what those numbers compare, and if there is a way to compare what we were having from the walk-in clinic being at Stewart's Creek as opposed to have moved it over to the New Salem clinic. Are we seeing the same numbers of walk-ins, more or less?
I think we might be able to go back and capture maybe the appointments to see if, how they were created, whether they were walk-ins or not. I'll have to go back and see on that.
I think it would be very hard to compare this being such an unusual year. We've had a mask mandate since July 22nd. School started back up in August, if you compare it to this time last year with school starting, and 40% of the 52,000 students chose to stay at home and have distance learning from that point. So it'd be so hard to compare because people are not out. They're taking more precautions than they normally would. They're not, there's not as many germs flying around. A lot of people staying at home. I just think it'd be hard to compare, this new location. But let us get on into a little bit colder weather. We may see an uptick in visitations. Mr. Elam?
Also, we'll mention to you, this is just a very snippet. We have worked on a report to come to the committee once we have a full month. So this is by far not what will come to the committee next month. It's just that we had a partial month, and this is what they've been able to put together quickly to give something to the committee. But we should have, and again, it's going to be a full report of September, but we will have a better report for everybody to look at next month.
Okay. Other questions? Mary, was that answer your questions?
Yes, sir. Thank you.
Okay. Other questions, members?
Mr. Chairman, this is Commissioner Allen. I've got a comment.
Commissioner Allen.
Ed, Mary kind of spoke to some notes that I was jotting down. It was my same line of thinking, which was as you build these reports, one of the pieces that was always the most beneficial to me was being able to evaluate our investment per member per month. So that way we kind of see, what is it costing us? Because that helps us identify if we're containing costs. And so as you build that report, if you could make sure that that's a piece that we continue to capture, I think that's very beneficial.
I've got it written down for you. So,
Thank
and
you.
Christy, you heard what she was saying?
I did, and Ed, I believe we've already considered that in the report format that we have drafted and kind of put together in preparation for next month. But I will double check and make sure it's included.
Great. Thank you.
Other questions?
You're welcome.
Other questions? Seeing none. Thank you, Krista. Look forward to seeing you next month. Last members is other business, annual enrollment update. Mr. Elam or Ms. Griffin?
Mayor Ketron, we just wanted to bring to the committee a little bit of an annual enrollment update, and just to kind of give you an idea of what we have going on. It's a very different year than what it was last year. Last year, Cigna and a representative from the risk management group went to just about every school and every department. This year we were unable to do that due to the coronavirus and schools being out, whatever. So this year we've had to make changes, and Melissa and I will discuss a few of those changes. One of them is we've extended our open enrollment time. We're going from October the 12th at noon to November the 2nd at noon. So that's adding an additional week to the annual enrollment. And then we're also extending our hours from 7:30 to 5 o'clock. And this is just trying to capture, I know teachers sometimes, they want to give you a call instead of an email. And a lot of the times we answer our emails late in the afternoon and they can check their emails at night. But sometimes they just need to be able to talk to somebody. So we're trying to extend those hours just a little bit more. And due to the fact that we weren't able to get into the schools and answer a lot of questions for them. And keep in mind, people procrastinate, and if you wait till that last week, you're going to have a longer wait time. You're going to get voicemail more often, and we will get back with you. We'll do everything we can. But if you do it in an email, we have a ticketing system where someone can pick up the ticket and try to get back with you as quickly as possible. And that would be my advice. If some of you don't have email or computer and you need to come in, then also I think if you just call and try to get an appointment, we'll take walk-ins, but if you make an appointment, then we make sure that we have a benefit specialist available for you at that time. Because some of these appointments, some people have some changes in their medical needs, and it might take an hour and 15, 20 minutes to try to address their questions and whatever. So we want to be able to serve everybody as quickly as we possibly can. And that's why we've extended that extra week. We have 7 people dedicated benefit specialists in our office. And I think there's somewhere close to 6,200 members plus 6,000 plus members on the plans.
Right.
And that's a lot to get done in 3 weeks, but we would like to be able to, if we can kind of address each person as quickly as we can, and especially through email. Melissa, do you have anything else?
I was just going to say we got a new email address set up that goes into the ticketing system. So instead of it going to just one person, it goes to a team in our department, so we can all kind of pitch in and help make sure that the employees are getting serviced in a timely manner during the annual enrollment period. We have guides that will be going out next week. There's a full packet that's mailed to employees that contains information about what we're offering for 2021. We do have 2 new vendors this year. If the committee remembers, we voted on a new life insurance carrier and a new disability carrier. Something that the carriers are offering this year in our life insurance, it does not happen very often for employees, that it will be a true open enrollment for them, where they are allowed during the annual enrollment period to add additional life insurance for themselves, or increase the amounts they already have in force up to guaranteed issue, or up to 5 times their salary, whichever is the lesser, without having to submit medical evidence of insurability. We also have added a new disability carrier, which is going to be the standard this year. In the same manner, they're allowing anyone that would like to pick up a short-term disability policy, or anyone that already has a short-term disability policy in place, to increase their amounts during the annual enrollment period without a penalty, without having to undergo any kind of evidence of insurability there. We also sent out an email last week, since our guides aren't coming out until next week, to help employees, since Mr. Elam said we were not able to get into the schools this year due to COVID. We put together an email that contained 4 different flyers. The flyers included information, given a preamble to the medical plans, what the rates will be, what the plans cover in a nutshell, just the basics, and a Cigna Choice tool that helps the employees better pick a plan that suits their family and their needs better. We also included a flyer to our enrollment platform, which is currently ADP Workforce Now, for employees to get a jump start, making sure that their accounts have been activated, verified if they've forgotten their passwords, or if they never signed up for an account. We also included a flyer for the Motivate Me Wellness that kicked off again October 1st for the 2022 plan year premium reduction. I think that's all. We also have a presentation that is in the finishing stages that will be posted to the Rutherford County website. It will also be available if an employee needs that sent directly to them. We will have the option to send it to them via email. And that's it.
Okay, that concludes your report. Thank you. Other questions to come before the committee? Any concerns? Hearing none. Is there a motion to adjourn? Commissioner McAdoo, thank you. Is there a second?
Second.
Got a second? All in favor signify by saying aye.
Aye.
Motion carries. Y'all have a safe day. Thank you.